You're watching CommonWell TV as we're in Orlando, Florida for HIMSS 2017. Niko Skievaski, he is the president of Redox, R-E-D-O-X, one of the newest members of our CommonWell Alliance. And with that, Niko, tell us a little bit about as to why Redox found CommonWell so attractive to be a part of.
So we really believe in CommonWell's mission to allow data to follow the patient. We enable technology applications to work with health systems and their legacy technologies that health systems have to do just that, and to allow technologies to move into healthcare settings where they wouldn't otherwise be able to move into. And so we thought by working with CommonWell, we'd be able to find a way to do that. And over the past few months, we have. And so we're going to talk about in a little bit, but that partnership that we're forming between CommonWell and how we actually support the network.
What excites Redox here in terms of interoperability over the course of 5 years, 10 years, and beyond?
So I think that it's been really interesting from an interoperability perspective to watch how the industry has evolved over the past few years. Initially, people were using technology to achieve some strategic goal. So they had a strategy at the health system, and they needed technology to support that strategy. And so they needed those technologies to interoperate. But now that there's been more strategic wins from a technology standpoint, they're looking at actually going down market a little bit to say technology should be a strategy in and of itself. And when they say that, interoperability becomes a platform in which technology can be enabled across the health system. And as we look forward in healthcare, I think that more health systems are going to be needing interoperable platforms so they can turn on technology faster, they can start democratizing the technology adoption down from the CIO level to the department level to potentially the provider or the patient level, turning technology on out of the box, much like we turn on an app in our phone and delete it if we don't like it, try something else out. We can get to that point if we have more interoperable systems in healthcare.
As you know, CommonWell will be rolling out some new service offerings, one of which is the API. So with that, how does Redox necessarily fit into contributing to that API?
Yeah, we contribute in a couple of ways. So Redox has a more modern API platform, and what we've done is we've hooked up that platform to CommonWell such that an application, a modern web application, can connect to Redox over a web service hook. So it's a modern application programming interface, JSON data exchange, and essentially enabling an application to interoperate with CommonWell without having to meet the specific CommonWell specifications. So applications can connect to Redox, Redox connects to CommonWell, and we can utilize the network through that. Additionally, the second way that we're working with CommonWell is now providers can join CommonWell as a healthcare system, or as a hospital, or as a practice. And regardless of the EHR they're using, the healthcare technology they're using under the hood, Redox can enable that technology to interoperate with CommonWell.
He is Niko Skievaski, the president of Redox, and for more on them, log on to Redox, R-E-D-O-X, engine.com, and as always, you can log on to CommonWellAlliance.org for more. Thanks so much, Niko.
Thanks.